Hello, friends and classmates and Professor Osborne. I hope you all had a wonderful semester and enjoyed learning about drug use and abuse and the role that it plays in our society, both here in the United States as well as worldwide. My name is Callie Pollock, and I am a social work major here at Montana State University Northern, as well as at Salish Kootenai College in Pablo, Montana. And today I will be summarizing an article published by the National Institute of Health back in September of 2020 in regards to substance use disorders and how they are linked to COVID-19 susceptibility. This article summarized what statistics are showing after studying millions of people contracting COVID-19 in the United States. Numbers have actually shown that COVID is affecting those with opioid use disorders the greatest compared to all other individuals with substance use disorders, and behind opioid users being tobacco users. Even though about 10% of the study included people with substance use disorders, they still make up nearly 16% of the population that is contracting COVID-19. Additionally, individuals who had a substance use disorder and contracted COVID-19 were shown to experience worse outcomes from the disease, including higher rates of hospitalization as well as higher rates of death. One of the reasons behind this is because often the lungs, the cardiovascular system, as well as your overall health are greatly compromised in individuals with substance use disorders. Another reason being that often people struggling with addiction tend to be marginalized as well as discriminated against. This can make it very difficult for them to access proper health care, and it also provides a unique challenge for the clinicians that are involved with caring for such a vulnerable part of our population. The data in the study was collected from 360 hospitals up until June of 2020. It was collected by two doctors from the National Institute of Drug Awareness of Case Western Reserve University in Cleveland, Ohio. The research was also paid for by the National Institute of Drug Awareness, and the study included over 73 million patients, of which 7.5 million had been diagnosed with a substance use disorder at some point in their life. The type of substances included in the study were opioid, cocaine, alcohol, cannabis, and tobacco. The hospitalization rates for those with substance use disorders compared to those without were 41% to 30.1%, and the death rates being 9.6% to 6.6%. Another statistic that the article summarized was that African Americans with a recent opioid disorder were over 4 times more likely to develop COVID-19 than whites who had had a recent opioid disorder. Overall, the article was a big reminder of the drug abuse issue within the United States, and that it actually can be addressed as an additional strategy for assessing the COVID-19 pandemic. I personally found the article to be very interesting. I think it's clear that drug use is hard on somebody's body. I think we all know that, but I had no idea it would make you that much more susceptible to something like COVID-19. Being from Montana, I do understand how different our healthcare situation is. Living anywhere in rural America, even if you are not a part of a minority, healthcare is much more limited here than it is in other places. If you consider places like Montana or even the Navajo Indian Reservation, I think it's important to remember that people don't have access to the best healthcare, partially because you live hours from major hospitals. If you consider places like the Navajo Reservation, which at one point had the highest infection rate in the United States, according to the Center of American Progress, I believe that the National Health Institute, as well as the reservation, did a really good job attempting to combat the issue. When the reservation's numbers began to climb, it was claimed a crisis. The reservation made it very clear that they needed assistance. Eventually, hundreds of healthcare workers as well as American Red Cross volunteers were outsourced to the area to help out. But I must add that there was a bureaucratic delay in the outsourcing that should have been avoided. As far as minorities like those in the inner cities, I don't have any experience with how their healthcare works or what their situations look like, but I would hope, being that they are so close to major hospitals, that they might have more access to good healthcare than this article appears to be. It's not that I don't think that they aren't often discriminated against, but I personally would think that these numbers in the article have much more to do with how the drug use has affected their bodies, rather than them being continuously and always discriminated against. When you consider the information within the article, what should we do differently as we move forward? As it mentions in the article, this does yet again point out a major spotlight on the substance abuse issue within the United States and what additional issues stem from our substance abuse issue. I think this article gives a good example of how combating the substance abuse issue could actually begin to fix a lot of the problems within the United States. And it teaches us that we have to notice how other communities are struggling in pandemics or in situations like this one, and doing what we can do to make it better. This goes for volunteering your time, encouraging government mandates or funding that improves the substance abuse crisis, and doing your part in improving the crisis yourself. As a social worker, I believe a big part of it is advocating for mental health and emotional health, and I'll spend my career doing the best I can to do my part in that. Thank you all for watching, and have a great day.